Hi, I'm Dr. Barbara Beyer, and you're about to view a short video about your toddler from the doctors here at Washingtonville Pediatrics. Let's start with a look at how your 15-month-old is developing from our friends at Simply Parenting.
"15-month-olds are energetic, on the go, and sometimes a handful. And there's a lot more communication going on. Granted, you won't be able to understand most of what your toddler says, but there'll be lots of meaningful babbling going on. This is called tuneful jargon. Your toddler will study your facial expressions and imitate the tones in your voice.
What do you got there?
And eventually, you'll be able to interpret at least some of what your child says. And he or she should be starting to name and recognize body parts, follow simple commands, and answer simple questions. At this age, expect your child to be saying at least 3 words beyond mama and dada. Your baby's fine motor skills are also improving as attempts are made to use feeding utensils, drink from a cup, and build towers of 2 or more blocks. Your 15-month-old will also become interested in trying to fit different shapes together, put pieces into a puzzle, and play with nesting and stacking toys. You'll notice that he or she will now be purposefully combining objects, using one to affect another instead of examining each one individually. Your toddler may scribble with a crayon on paper, use a broom to sweep the floor, or hold out one object to reach another. This shows that your child is beginning to solve problems and use his or her imagination. As physical strength and coordination improve, get ready for your child to begin to climb, run, and jump. Most 15-month-olds can also begin to creep up the stairs. Some can even figure out how to get back down again. You can teach them how to do this. Backwards is safest, but don't take the gates off the stairs until this skill is mastered. Again, remember that each child develops at a different pace, and sometimes new milestones can be reached when you least expect them. Enjoy each phase before it slips by, and if you have any concerns, speak with your doctor.
Your infant should be having 3 meals a day now, and the entire meal should be finger foods and table foods. Despite the mess, have your toddler use fingers or a spoon and fork to encourage independent eating. To decrease the chance of nut allergy, continue to avoid peanut butter and all nut products. To avoid choking, remember to cut up all foods into small pieces and avoid hot dogs and grapes. Never let a toddler eat without an adult present, and never let a toddler run around the house with food in his or her mouth. It's time to be aware of giving your baby too much fast food, which is filled with saturated fat and salt. Remember that too much whole milk can lead to anemia, so limit your toddler's daily milk to 16 to 24 ounces per day. Toddlers do not need juice, and drinking too much juice can decrease a baby's appetite for other more nutritious foods. Try to limit eating to meal times and avoid continuously feeding your toddler in the car or when out on errands. Your toddler still needs 12 hours of sleep a night, but don't be surprised if the morning nap disappears. Establishing a regular bedtime and bedtime routine is very important. Since toddlers can't tell time, they thrive on routine. So create a bedtime routine and stick to it. And protests will continue, but remember that an overtired infant will be more irritable during the day and have more tantrums. So it's okay to let your baby cry and fuss a bit when placed in the crib. Most toddlers will fall asleep within a few minutes if left alone, especially if you have trained them how to go to sleep on their own. If your toddler wakes up in the night, go in and comfort briefly, calmly, and without lights. Repeat in a soft voice, "It's night-night now, time to go to sleep." After a while, they will get the message and settle down. Toddlers can climb very quickly, so remember to remove all large toys that an infant could climb on to escape the crib. But if your toddler keeps trying to get out of his or her crib, then it might be time for a toddler bed. Teeth should be washed with a washcloth or very soft toothbrush at the end of the day. No toothpaste is needed yet. If your baby is uncomfortable from teething, acetaminophen will be helpful. Check with our staff for the correct dosage for your infant. Continue polyviflor daily unless your water is fluoridated. Do not give any medications to your baby without discussing it with the doctor first. Avoid all over-the-counter cold medicines. It's too early for toilet training. Best to wait until the second birthday. Parenting a toddler can be challenging. Let's take a look at some tips from Simply Parenting.
Many parents describe life with a 15-month-old as trying. Their toddler is trying everything. Their developmental task is to explore and learn, and the responsibility of parents is to allow this to occur while protecting them from harm. This will inevitably lead to daily conflicts and expressions of frustration. Some 15-month-olds may begin to have tantrums when you restrain them from an activity or remove a harmful object from reach. If this occurs, stay calm. Don't give in and use distraction as much as possible. Toddlers can go from screaming to laughing in a matter of seconds. And don't expect your toddler to obey your commands. He or she has no self-control yet and is only beginning to respond to limit setting. Be calm, firm, and consistent, especially where safety is concerned. Over time, your toddler will begin to control his or her behavior. Just remember, he or she really is trying.
Hi, my name is Colleen. I'm one of the nurses here at Washingtonville Pediatrics. Now here's some advice from our nursing staff. Remember, never give any medications to your baby unless instructed by your doctor. And no cold medicines should be given to your baby at any time. Here are some reasons to call the office. If your baby has a fever with temperature 102 or greater, if your baby has a fever of 101 or greater persisting more than 24 hours, if your baby's more irritable than normal, if your baby's not waking to feed or is refusing to feed, if your baby's vomited more than once, if your baby has a severe cough, wheezing, or is breathing faster than normal, or if your baby falls and hits his or her head hard, especially if there's any loss of consciousness or there's a visible bruise or bump.
Let's end with having some fun with your 15-month-old.
Activities for 15-month-olds can take advantage of the fact that they're now upright and on the go. Babies this age love hiding and chasing games. Remember to end every chase with hugs and kisses, which will delight your child.
There she is.
They also love to listen and move to music. Some kids respond to kiddie music, while others get into classical, jazz, or good old rock and roll. Likely your house is now filling up with playthings, both homemade and store-bought. Remember that age labels on toy boxes refer to safety issues, not developmental level. Good playthings for this age group include pull toys, a sturdy wagon or doll carriage, shape sorters,
Show me.
stacking toys, a riding or rocking horse, nesting blocks, and pots and pans. All these items help your child develop and practice new motor and cognitive skills.
Look at all this.
When quiet time is in order, pull out a picture book. 15-month-olds love to be read to.
Mommy.
They may ask for the same story over and over, so fill your toddler's library with some of your favorites.
That's Cinderella.
Thanks for watching. We'll see you again when your toddler is 18 months old.